Hi, my name is Caleb Bertelski,
And I'm Jared Noonan.
and our report is on discrimination in health and social care systems. What is discrimination, you may ask? Well, in simple terms, discrimination is unjust treatment based on grounds of race, sexuality, gender, age, etc.
Why should we be worried about discrimination? Although discrimination is one thing, this one thing or idea has been known to tear apart cities, states, and even countries, as it has attempted to do so in history. For example, the Civil War, when the North and the South turned against one another because the South thought their states' rights were being taken away, and included in the so-called rights were African American slaves. Can discrimination affect your health? Discrimination is a public health issue, according to the 2015 Stress in America survey. People who say they have faced discrimination have higher stress levels on average than those who have not exposed or experienced discrimination. It can be very stressful even if you're not directly impacted, especially if you're a member of the group that is typically discriminated against.
What about discrimination in healthcare? Yes, discrimination definitely has its own effects in healthcare. For example, Hispanics are the second largest ethnic minority group in the United States. There are 55.4 million Hispanics living in the United States. The Hispanic population specifically experiences several forms of health adversities. For example, 8% of Hispanic adults were diagnosed with heart disease, and more than 13% have diabetes. Health problems such as diabetes can lead to poor health outcomes among Hispanic men in particular because of health disparities. For example, lack of access to health care services contributes to 69% of Hispanic men not making regular visits to health care providers. Now on to our interview. For our interview, we interviewed a lady by the name of Joyce Conway, and she gave us her own private thoughts on discrimination and how they affected her. So, question number one, we asked, what are your thoughts on discrimination? Joyce had to say, I believe discrimination is very real. People discriminate against other people because of their race, their religion, and their sexual orientation, gender, and disabilities. Question number two, how does discrimination affect you as an individual in today's society? She says, I did not notice as much discrimination because I am now retired. While working, I actively participated in education to help our staff not discriminate or judge people, patients, or families because they are all from different culture or backgrounds. We frequently had discussions or educational events to help our staff become aware of their own prejudices and preconceived notions and gave them resources to learn about other cultures.
Our third question, have you ever witnessed a discriminatory event in person, or have you personally ever been discriminated against? Joyce said, I have witnessed numerous events of discrimination in my lifetime. Most instances did not involve me directly. However, when I was in the second grade, a nun that taught a religion made fun of me and singled me out because I was short. I witnessed my mom confront her in front of the principal. I was so proud that she stood up for me. My mother also wrote about an event in her book, A Matter of Pride, when her mother stood up for a man that was a bully and neighbor. Our fourth question, how do you believe discriminatory actions could affect patients in health and social care? Discrimination in healthcare can handicap the healthcare provider by not allowing them to see and accurately diagnose a patient that they have prejudice or do not understand cultural differences.
Number five, do you think discrimination is more impactful in a public or private health/social care system? I honestly think that discrimination occurs more in private hospitals because some private hospitals are staffed by people that have not learned about different cultures or are not comfortable with people of different races, religions, and backgrounds.
A final question, if someone was to witness discriminatory actions/events, what would you encourage that person to do? If someone witnessed discrimination, I would encourage them to say something about, but in every situation, safety is first, and you cannot put yourself in physical danger. However, you can report the incident if it occurs in a store. You can report it to the manager. There is always someone who can change that. you can report the incident too.
Thank you for your time. This is our news report, and I hope you guys all receive something out of it.
Have a good one.